talofa lava malo le soifua manuia whawhetai lau mai mua mai i le whaungangana podcast. O le por kalame tala noa ina i le soifua o le mawhauwhau, ma le ngase o le mawhauwhau, i o na vaenga ese. O au o Dr. Taavale Ioana Mulipola, o le mental health nurse, o le whaia aunga foi, i le nursing school, i le universite i au kilani i New Zealand. O le por kalame mua le nei, o le season 3. Ua mawhaatasi ai ma Fuimaono, Dr. Karl Pulotu-Endemann, i sona finangalo i le autu o le por kalame. Ai maise o lona soifua tautua, po lona soifua ngalue. I le soifua malolo ina i New Zealand, ai maise lava i le matanga luenga ale mental health. Usi mai loa lau whafunga.
Ia, malole soifua Fuimaono whapetai lava le whaawanoa ina o lo te mita ua tate talanoa ai le whaungangana podcast. E tā ua mama walunga le nei por kalame, ona ua mawhai ona whaawanoa ina mailo lo te mita te talanoa ai. Ona e ala na mawalunga, e le ngata o le pioneer o le Pacific nursing i nei New Zealand. Ia e whaapea fo ia le mental health nursing o le tausi soifua mua sa mua na e asaina le ngasu o le taitai au pe o lea upu i nei New Zealand i le mental health nursing. Ia o fo i na e developinga le first Pacific health model i nei New Zealand. Le olo o whaonga ina i tono le soifua malolo ina. Ia ma o fo i o maua le whailonga taualoa ia po le Queen's Medal mo lau tautua i tono le tato community. Ia mele o te whaatalo whaloa ia atu i lau fionga. Ia aele i amatale ta por kalame. Ia e watu le nei avanoa e whailoa mai fo i lau fionga i le mamalu le tato au whafonga ia e whapea fo ia i la tau olo mwhai ona mai mo mai le ta por kalame le nei aso.
Alo lava soifua faafetai lava mo le avagoa lau susuga le fomai Dr. Ioana Mulipola faafetai foʻi le gei kaimi ma le avagoa me mo le kuai ia si aloa faia ma greetings foʻogale le mamalu paʻi o leo o sa mo leo la mo mai lau pokalama pa lo kaimi ge faafekai lava ge avagoa Ioana, it's great to see you. Ia ma lesi i kuga ki faatuloa kua o isi kaimi e vave aku lau faapalagi le Samoa. Because what we look so we're living in Sea Level so le lima viva. I was just about 7 when I 8 when I came. I turned 9 when in Sea Level. So we're living in Sea Level. But what we are through and through, what we love it Samoa lava. Kusa lava bit over leons full fie ene sang in Sea Level what we love Samoa. Al menga lo ke fa kai ek mange va ia ma fo ngale male kai mi fo ngale kai fen ska kala I sem fisi ofisi se me la ki fi ona fo ngale de mai ni ka fo ngale towards your podcast
Ia malo whaftai. Ia, Fuimaono pe ona o tā ua foi lea o le season tolu nei, por kalamelo na tolu nei a le whaungangana podcast. Ia o le theme la o le por kalame tolu po le season 3 nei. Theme is culture is the medicine. O lona winga. O lo ia I tātou lava le fofo o tātou whawhitauli. Ia po o lo ia I tātou lava le fofo e mawai le soifua ma lolo ina o le mawhauwhau. So le aso fina ngalo I le autu o le por kalame lea le season 3, whamon mole.
ke loa Ioana e seke le maku fi o le the background ma le philosophy what behind it but I also listen ko le o le podcast o le whongale it's to build up le ngangana samo to build up whau le ngangana because that's a really important issue culture for Samoa doesn't stand still. It keeps developing. So in my Samoa, for the 1950s, was a very different Samoa now. If the 2026 so le binga la o lo kara esa kelma makungofio la ole o le whakangale le title o le nge podcast e whaunga Samoa, whakangale whau. Because that's what it's about. It's you're gonna build up everything. You'll find more whether it's ngangana or Samoa or whether it's in health. You have to build it. You have to build it. O le mea konga ia kaula vei. That is the whole excitement of it. Ia whause mea whangale. And you keep building it. Because he le kumau and I like to talk about some of that because whaavai, there's a old Samoan we're all familiar with ngai e kumau whaavai as suiwhenga. I really like to challenge that. Because it's I can't take that as gospel because whaavai will promote as Samoa. To me, it's changing because the changing all the time. O le change o le environment le ka kung ngofo ai nge sila o le environment lo o king of o oenga ki ngai o kilangi o lo king e Christchurch, so it's different. Lo winga o la kala, it's about it's constantly changing the time, the environment lo fo usule kau. So there's time. So back to my point, to me, it's about time we need to relook Samoa. You know, for instance, one of the and to me, as a health professional, if we are a health professional, we have to constantly, you've got to constantly ask the question, inquiring, why is this done? Why? To move it on. You know, our challenge mele Samoa is actually, that only came through after it became independent in 1962. Prior to that, you know, Samoa, and it's a real big challenge to all of us. What we're talking about, a Christian God, but we know the history o Samoa, titles, goes back hundreds and thousands of years. So the Samoa, it's not just built on Christian. Yes, we are all Christian, but it's also built easy for beliefs and values. And that's the same as in health. So it's a long, I'm sorry, it's a long to say that, but that's what I believe. The question is the medicine, the culture is the medicine. Because, and this is always, this has been my lifelong thing, because I challenge a lot of things. And I just want to bring in the conversation, why I did the Fonofale, because that's one of the questions, to answer your question. When I first started nursing training, because the Ongo training is a psychiatric nurse.
Okay.
Psychiatric RPN, registered psychiatric nurse. So I trained at Oakley County. It started in 1971. The first, and then I didn't quite like, they said health, the definition of health, was based on the World Health Organization definition. You know, health is a complete state of mental, physical, so you know the one. And it's nice. And I asked the question is, definition I always remember the matron said, "What do you mean by that?" Well, where is Mo'ainga? Family is it's a fundamental for me. So it's under social. Aka, because for me, social has a different context. Knowing it. And FMA, social, it's like I understand for one, family is under social. So from there, I always challenge. See, you and I, we went to school if but so there's a different worldview. Samoa. And for me, so for me, what's exciting thing, there's always that tension. The tension between what's Samoa and one of them was how they see health. And I just want to go back to and medicine. Or the culture. Culture is because health is a culturally defined term. Pero, and a lot of parangi, looking in kili. Lau parang, oh, you Samoans, you also define health as culture. You define health as, from your cultural perspective. You use languaging as that. Culture is your medicine. I'd like to give an example of that. When I was involved in the research project, le Ryan, Margaret Southwick, and Tim Kennelly, it was about primary health for Pacific. What were leading focus groups in Christchurch? The facility thinks King Samoa. Ola, first of all, it's in English. What's your view of health? Sablecal for me. Oh, when you're cold, when you get the flu and you're sick. Same question, but lalo marama le makaupuleo le soifua malolo ina o ya. Oka, yanga kele e o makuainga o whalavelave i a alo roku makuafu e kare si kele. So immediately tells me to answer that question. Culture has a major view. When you ask a Samoan, she comes from but also the view of soifua maloloina. It's more a wellness, whereas health, as is defined, and more so with the medical model, is more disease, as we know, and more reductionist.
Yeah.
That's I'm sorry but so go back to your question.
Yeah.
It excites me. You see, this whole thing, Ioana. Your question excites me, Ioana. The thing, what I try for ngale if I saw, culture doesn't sit outside. Culture and clinical goes like this. You can't, if you go back, that's one of the reasons to go back to the Fonofale. I mean, I'm sorry. To me, the Fonofale is dated. I mean, I developed in the 1980s. But now people use it. And I think the reason is because now people can look at ole Milwasui. The whole thing about the success of Fonofale is because people like you and others took one look at it from, I can do something with that. So the most important thing about Fonofale, o le kangaka le viewinga le maru. Because o ko kele ska be, why is ke pipelu yike o la mo fan. But that's one of the reasons why I used it, because it answers a question there. Culture is the medicine. Because it's not only the treatment, the support, everything comes together. Because it's not just culture. If people ask me, so the mental health, what is the most important? Okay, because I know the student on the post has got mental, but the student I love most is a student that says, "Oi, ole Samoa," or let's say for my all the time, or let's say for my also sexuality, or let's say for my physical well-being. And they're all correct. It's not just ole whapalangi, what divide umamea is au kako, the mental health of ngale it's all part and parcel of the totality. Or totality o kangaka. E ke le mawhane kango separate and that's my belief way back in the 80s. And it still is today. So it's really a belief that people are complex. And is to lower kipi to cut them into pieces. You can't do that. It's actually culturally offensive to cut people up like that.
Sa ole le ala sa noanga. E pela le ole au tova au tanga o le tatu atunu i le soifua maloloina. Pela le e aluatu o le tinga le ulu.
Yoi.
Ia, ele whamawainga kilo a po le almele ki ngā i le ulu. Ia kako waia Samoa, mo le Pasifika, e kilo a koa po le almafuanga o le ki ngā le ulu. Wa le alanga sau I whamai o le ki ngā le ulu, le roko le si, e si mafuanga le alenga ngā ki ngā le ulu o tangaka.
E sau le leia, no, e sau le leia mea. O kere roa sa kaka whapema, it's, but it's a challenge for Yakakonge clinicians, nurses and doctors. I mean, we've got to accept the fact we're colonized.
Yeah.
We are, because we my view of this, whether you are a toshi soifua or the formae or social worker that was trained in the institution, parangi, it's your major focus is finding your way back home, your way back to your situanga, where you came from. Like I lived in New Zealand. I always go back to Samoa, more communities, because that is the medicine for me. It's back to my own people. So that's a roundabout answer to your culture is the medicine.
Yeah, malo whawhitai. So since we are on culture, Fuimaono. So I say ala ka ua ile ka ko tu maleanga nu. E malama ai, e wha malama ai le mental health mo ka ko kangaka.
Because for one two it's just a pride. You know, what I learned, and I learned that when I was teaching Mesias Tun Samoa. Ele ais can it's Samoa whether they're undergraduate or postgraduate. And if I look kalafa pe loa, so pongo oe na ese e kirea ka mai por ko ainga. Kirea ka mai oe nenga a le pasi ka ngi ka mai oe lungo le tanga spasi. Wai le pasi wa ki pa ye le po looking amalo ka mamalu ko ai la so fonga le fifinga ke lo le va venga sui le ami o kanka ngi le va o ke le lo pe wa fifing ke o ke fonga Steven Stalin po me le ka sa utras pa fin le pasi po le po la o ke lo le le me sa o ka ka ngi po ke si le ilinga. It's because it gives you a sense of pride. You know what, Ioana, there are two things here, me personally, non-negotiable. It's like non-negotiable. First of all, being Samoan, Malisiku or Ulfafafinge. I can't do that. You can change everything about you, Mafangia, Kaung, Suyen, Menga. Matawa Kanako, Gilonga, Olekua. Our sister, Kiri Mafaya. And that's part of that question, go back, because those two things, Okilongalilea, I came from. Like I see my name's coming up, and I know each time I look at that name, it's not about me. Fuimaono comes from Sarangi, it goes back 1,500 years. Karl is after Karl David, who's my godfather. It's different spelling. Pulotu sama malai malu falealili, or grandfather, or grandmother, or Fonofale. So an Enderman, some Fangamala. So to me, it's because I represent those people, not me individual. So I'm an individual in amongst the collective of that's what makes me who I am. It's okay, is it because I come from that kind of background. Now, some people might say, I'm not. I'm very proud of the fact that I come from that. I'm very proud of the fact that we came to New Zealand and like all other Samoans, we had to start from afresh. But that's what gives you a sense of pride. If like I think you were part of the students, one of the first exercises I've been doing for nearly 40 years now. Although first you had to stand up, faile greetings you come from, and then say Oloingoa and then write your name. And 2 minutes you talk to your name. They mix up and who and then you find a lot of them realize they're not just themselves. It's independent. It's the me, myself, and I. But it's about us. It's about the collective. And all those other things come from that, Ioana. Oh, let's see it's very glib. Glib for more clinicians to use a lot of alanga upusamoa. And as a theoretical. Now, for instance, I get really sick and tired of hearing people saying, "Oh, lo ele li la po kama ka ila le wingol mele ke oki la ba la fa la ko ku ki le mafai yo foi la wo e make sure la ke le ku pe fa lo wo ki e ka ku fa le fo nga le me ka ka si po pe there's that issue e fo nga le ya ka it's a very it's because all those people those things they're practice. It's not just theory, they're theory and practice. O ka
Yeah.
fasa mo. E a mo le fonga le practice kwa sa wele
Yeah.
le theory.
E sa ole leila o fionga. Walanga sa e ka ki whaalonga ia i o i langa luenga ia ma mea fo i e o ai mo meo conference a. Mo
Wa
meo le whaonga ingna o upu sa moa ma alanga upu. Ia a taimi fonga le la e whaalonga ko le kau ia i skemi whaalonga.
let's just say no because go back to the context.
Yeah.
Pero le mele I was reading an article of it was just quite a prominent. I'm gonna get this is a bloody one. Let's just say. Like for my, you know, or for my, oh no, but Karl, you know, she's a very good clinician. It's not you, somebody else. Fuck, it's just a for my, it's a for if a full level element, it was her comment was to do with prevention. So, but the example she gave me, and then I thought, well, it's the same. Because in my own practice, when I was a kid, more for my aunties, grandmother, sasaravan kafanga, oi ole kafa lisi kula. I was sasas kama kicking out ole kama kelele for mele ole. We vai kuku ole aramea. In other words, a real good prevention is the person that said, don't go in that part or go to me, it's not a prevention. Once you stand on the Olalame,
O kuia vai.
yeah, but no, the thing is, it's not wheel away. Okay, I always remember my auntie said,
Yeah.
"Oh my, or auntie, she didn't mix well. Kawe for you, let me go kawe ole kula. Yes, okay, but she was right. So, in other words, the context of Olmedo Fanga, but they don't know the context of Mede, so Olmedo Lalomea.
Kusala e ka ua ia le makua malama le i le ngangana. Le whaonga inga o le
Absolutely.
ngangana. Ia malonga peso o ka inga ma le culture. Ina ia o whaatasi ai le whaonga o le ngangana ma le culture. E momori ai le whiaula le ai ia tātou le mental health. Talwai la o e you are a pioneer. Whatever foina e practice i le mental health. O le mental health sa mua i tono nei atunu. O le a le winga o le mental health ia oe.
Well, the mental health, really, it's a soifua maloloina. It's really about soifua maloloina. It's when your soifua maloloina is affected. It was la fakukusa le pal mamelo o ngei fo ngale malioka le Dr. Lisi Kaji pe kai ngaksila feeling ka ngalu fa asisamo. E pe ol mele ole what we call la sanga is it's orange and green. Bete se afoi. Say it's like a twine. It's twined together. The green represents the wellness. The orange is that when you're becoming anxious and anxiety, and then the red is it's the illness. Wellness, anxiety, and illness, they're all part and parcel of life. We don't contribute mele or wellness is wellness. Well, you can't. Because not anybody. This morning when you get up in the morning, you weren't all well you know, you're always a little bit dozy and so you're not fully well. It's only after you've had some breakfast or something, then you start to pick up or have your coffee and things. So in the period of hour, you actually shift each time. So to me, mental health is part and parcel of soifua. It's part and parcel of it. When you're well and when you're not so well and illness, that's all part of being a soifua. It's not you know, wellness is out there and illness is the other. It's the same. It's the same.
Yeah.
It's part and parcel. pe ola whakakusa ngā. Does that answer your question?
Wa pe fo lena e mention inga le definition and the World Health Organization. For le
Yoi,
mental health, e male health, which is e tutusa.
yoi.
Walanga e mention me la ko o le individual. Au ka
Ngā,
ko la pe la ona mali la usau noa ngai le definition o le mental health ia oe.
yoi.
There's a whole lot of information na e au mai e describe mai e le mental health ia oe.
Well,
Ia a tato wola le World Health Organization. E pe e lai sau sa o a le lola o kako ia e kele ia e kele ia description. E kele me e complex le kako o kanga kasa moa ma kako si o manga. That's all part of wellness. Ah,
yes, yes.
mm,
Ana ke lole si la whakukusa. It's no mo pala fa oh it's so sad. I fo no mo maliu. Mali sa
yeah.
mo. Oh so sad. Apart from o se pawale me ki eso ko fi wai me wo fo ngalo mo mali sa mo. O
Yeah.
me o fo ngalo you know of se mo fa yo ku mo limau. O
Oi.
le ska ka lai le lo la va be wala ku fo ngale fi lo. E alu po ma le o fa ma le. But the point I'm saying that emosi la ya ka kongi. Wala parang only few people for nga fa sila was only few au ka ko sa mo fa pe fi e se le ma ga yo le o ma di fa what you mean this is my ma kilo ka nga wak me kilo me ai fa pe
Yeah.
ka nga what you mean kilo me fa le lo pe ai ko mo me ai la nga but my point is pe yo e fo nga le ma nga e se fo nga fa sa pe ko ke ka nga ka fo nga lai lo ai o nga ai nga fo nga le alofangia.
Yeah.
Ah,
Mm.
well, I also went to another one, well, in this case, it was Afkasi. The first, ngalo la mang mo fo malishma ko ai. Apisi umelo atuma te fe kelil kupe ai. La lisi iba ai lingis. Fa
Kau le ai ngisi.
an o ye yo ngai la bo ma ki la ba ai. I iba ai lingis ka nga i o ala le we fo a kupe ai de ka we fa ngi.
Ese, yeah. Ese.
Yes, sa Samoa,
Yeah.
me konga ngai fo ngale, me lesi foi ku fa Samoa, e ke ai loanga i le fa Samoa ya ke You know how I put it very simply, ya ke au.
Mm.
Fa Samoa, fa to
Yeah.
me the first F-A-A. F to me first of all is fa'aloalo. If you aren't respectful to people, you haven't got respect for yourself, you've got
Mm.
respect. Fa'aloalo. The first A to me, ole
Mm.
alofa. Ale ai leo lo lofa, everything doesn't work. Pe ole, yes. And the other A is ole ainga,
Mm.
anga nuu. Well, and so all those A's, it belongs to the fa'a, for ngale ole alofa, ainga, anga nuu. Ia male akua. Because atua those to me is, and it's going to be a very interesting, Ioana, because ole akua is going to over but what way more things. You know, they become like parangi for ngale material things. But when more kuliara ko wile, you know, ka vale, nice houses, imea, more things. But those are there, but wa kuanga wa kide le mafa. But they can't be very simply. Le lofa ma le nganu ia ma
Mm.
kausi ainga.
Yeah.
But
It's
always
only.
whalualo. Whalualo is always
Mm.
bl-
Kusala Fuimaono lena e ta ua le Fonofale modo lenga e creatinga. Le
yeah.
mai lo experience i le longa lue ai i le mental health. O le lawa umana e saunoa le mafuanga na e creating ai le model la lea. Se i whai asina o tala popo mo i lato wele o malama po le ale le model lea, le Fonofale model, whamon mole.
Well, the first driving force about that, if the middle definition of health, because if it didn't fit the world health, so ngov ayak lore o le fale, salmon fale, because ng wolo ma was salmon for early life, in Friday, me yung nga fa over yay. But the other driving force, it was also two things, because ole ngoa kinga, grandmother kinga ngakosia wa ngolo mai grandparents. O Fonofale lale ngole o makua. O le kala anga o le name. I whongale a whangi whonga ingu isa e whongale le whalali li la so e ile le pu e whongale le amanga. O whongola e o kantha pe i o le la whonga ko inga i lunga le wha e ilo le pol malai la lo le paolo whongalo la au. I e pe kukongo le whali. O le kem kongala la whonga ko inga i kukongo le whali. Kongo le whale. E whanga ulo i le pepe e waku. Whamai o le pepe o le kengi le pepe ngai wha ingo lo lai. I think it was my great-great-grandfather. But o le great aunt o sau awha e ngau ni mele koi i lo makua. E commemorate e le whonga koi inga ko Kongo le whale. Her name was Fonofale. So it was shortened to Fonofale. That's the name. But ole me, it's really important. Ko Kelo Samoa, to this day, they still, from my se kale le ingame o Fonofale, not le Falefono, because leva pe o mo Falefono le ai. Ole, it's to commemorate a event. O le whangaunga lo grandmother, she's a life fongo inge Kongo Fale. But the reason why I use the Samoan house is because o Samoa, Malesine, ke masang me Samoa, mo pau. Ngal pau me se se ai. O le bai wha pau, me ngau se se, always confused with the Maori whare te pawha. But we all know, I'm not very good at drawing. The Fonofale, I got somebody to draw it for me, but it was just a post. So instead of having many posts, more po kelopo, I just put the 4 posts as other. So there's the other, it's gender, social, economic, sexuality. And then I thought there was other things. It wasn't just that. That's fundamental to that. For ngale mopo o le ainga is whaavai o for ma losi po o le history mo me uma le o for ngal whasamo is o whaavai la ainga. Or your family, because in the for ngale le i le whaavai o le whale. Ngai ye o po le floor le whale. I le foundation. That's why I put there as family. O le malpo le roof o le whale is a culture. The culture for to God, it keeps the rain and all the other elements, it protects the family. So there's a number of history. And then milo le fale, il mele le environment, time, and context. It's sui. Because anything I believe, it's a dynamic model. It means it keeps changing and being adapted. But le me ka ua lava me le Ioana, what excites me is that many people, I developed it for undergraduate nurses in Palmerston when I was teaching nurses. But the people that now uses it are not only researchers, but people like MSD, education, it's a big, even treasury. But the one that excites me most is the Aingam families and schools. And also artists, that's the other more, all those young artists, they're using it as a foundation for their work. To me, it's a very simple thing, but as I said, developing in 1980, 85. But the other influences on the model, it was because of all the other things that's coming up. The HIV/AIDS came, homosexual reform, women's rights were in same time. Also the Dawn Raids. Remember the Dawn Raids was in the 70s, 70, 71. Well, I started my nursing training in 1971. So there's a lot of other political influence. That's what I mean by context and time.
So how do you see so why is the Fonofale model important in mental health for our Samoan people?
E fo ngale ya ke hablo vai overseas for my kangaka or kali my kangaka. Oh, because I see myself in it. But it's not just Samoan, Ioana. The biggest supporter for the model that made it famous weren't nurses or more for community support workers. And there were 3 of them. One is still alive, o Malianga Eric, she's on Iwe, o Lesi, o si o makua kongo Peti Tevi, Yeah, and to some extent, according to Mansuki from the Kokal, but the rule of Kawa, the Konga Malay, because they saw themselves in it. And that's what told me that this model, because I also tested it nationally with different cultural groups. Different, oh, no, we believe that's the main thing. It's family, culture, and my posts. I didn't verify it, they did. You know, so the model is Samoa. You look at for Samoa, but a lot of other people saw it. And now I see Parangi use it. Like some of the indigenous people from Australia, they do it. In America, they also use it. But yeah, Kawi, that's what it's for. It's to put it out. But the philosophy behind the model is for people to make a positive difference in their lives. It's not just it's everybody. And it's not just mental health, Ioana.
Yeah. It's
Because
for health.
education, education uses it for teaching math students. And so, yeah, I guess I developed it for Ngalele. You know, Ioana, it makes it that I was that smart. I wasn't. I just put it out there, and it was people who made it. Or it's not me.
So why we are lo whainga luenga I le mental health. Not so much ia kako ia Samoa le kau kei loa le culture ma kako ki loa kui kako kangaka kau ke o me kia o le ke ka kei loa mo le ba fe lo loa ai ma me fa pena. Ai o kei loa o le kai dinga o le non-Samoan clinicians. Pe fo lao o teachers po o ile si vaenga le whaungaina. Ia awi e lao practice it's a really good framework.
Yes.
E kai dai ia le practice a kangaka i le understand ia kako.
Yes.
Mangkuala le kangaka whapeol palangi, ma le kangaka i le seunga culture kako Samoa. Ala kula le ngase o le Samoa. Kusala o le model le Fonofale model. Kilo ia inga ilo le ala ia o ia le whapea o la o focus i le kangaka lea. Walanga o le kangaka lea. A kilo le model. Ia o le ainga. O langa ngaluenga, ia malunga o langa culture, ia what are the practice o le culture o lea lenga course le stress. Is going me whapenga or let's see migration. Whape o le wa migrate mai ngengi sila, wa leave le ainga Samoa, maybe o le sau I o le struggle le suesenga luenga or something like that. Like course le stress.
Yoi.
So that's how I used le Fonofale model. I think it's more o le kaitinga o le au whainga luenga. Inga ia makua holistic le look after inga o kako kangaka. Ia mai o uma mea uma inga ia alu le kako kangaka wa foi. Alawa umanga ave support worker. Ave ei le fo mea lue le wins. Ia ave ei le support. E su e le ngaluenga. The whole thing, ele whapenga le la kuava I el whala au. Maybe go back in the theme for today, culture is medicine. If you understand our culture, you will look after our people well. So I think ole theme nga ole kakalanguanga ngai, which is a makua slot I neima highlight your principles ole Fonofale model.
So, Maria, there's a philosophy behind it. Let's say, cool. I mentioned more comedy, more dances. I was very interested in how. Well, I know people in health. Karl was beautifully. We said, well, most of us are New Zealand born. And when we see the culture, well, I see where do I fit in because brought up in Palang, but you want to learn about the culture. So, well, if the Samoa culture, you start off because you didn't know. Now you're moving on, and they got involved in you know those dance groups
Hip hop or something.
Nah. But what it is the using the family as the kids. So they're using it for themselves as an identity. Because they're finding their identity. Si o ka Samoa, we understand the differences. But pea o le fale, ai au sa bongi. Wele ko yang fale fa pela fonga o kere fal palangi fonga. But you see, that's because we were colonized. But it's very interesting fonga. But the concept is Samoan, but it's also changing. It's also fonga le wasui. O le se mea fonga le Ioana. I think we also is a challenge to us Samoans. It's a more me wasui. What is exactly fa Samoa? What is it? Is it because o kelo kakinge fa pe le yo la kelo kupe kelo me. But there's also like they just work in like manga me kua Samoa, but they living authentically as Samoans. What I'm saying is in the culture of as is in the Fonofale, there is a contours. There's some people who start their lives as Palang and they end up being Samoan. Pilmako ainga. One of my sister went to Samoa, she learned to speak Samoan, but she grew up in New Zealand. Others in Australia, they wanted to learn about the culture. So it's also about looking up within ourselves. We can't assume to take that you and I know because we can, but a lot of them, they don't know. The other thing about that is how, I just want to go back to the philosophy or the whauangangana. One of the things I really love is, more transliteration. Well, but that's part of the change. But I quite like the new one, which is upenga tafa ilangi. It's a beautiful word, like upenga, the net, throwing out. What is initineti? It's just internet. But yeah, o tafa po le Wi-Fi for the internet. Well, listen, I think that's a lovely. It's a developing, and that's what it should be, Ioana. I think in this podcast, to me, is a the future. Of here and the future, because that's what makes a culture. It's that aptitude that and maybe some of our clinicians. Well, we got to learn about the research methodology. We got to own the methods. There's also the we need to develop this. They should be on par. Not one, because on middle of it, clinical but I think it needs to be up there. I always remember o konga mai fafo. O la fiu le really slangy kind of because we were there as but most days when we were there for as volunteer for the Tsunami. Whaupunga, pe o mako, ye rola I o malkunga o ngā, a mako sa mo. O la mea ko, mai whaku, leo mai o mako, mako ingele, ngi mako ngi sa mo. So I think for this a real challenge both for Samoans, the Samoans, to develop the whangalangangana, but also the more values and belief of Samoa, and really look at me ko lava. I love the le o mole o ke look popi look kakoliko. I love the new Archbishop Fogaruke Akalen. But I love what he said. He said, "Ale lo fa le se akua," and I absolutely agree with that because akua is about love.
O te lo fo ole foundation fo inga ole ka ko culture ka tātou fa Samoa ole alofa fa vai uma mea uma lunga ole alofa e langa e fa alo o longa alofa ia on mea foi langa le kam fai e ka ko la ia Samoa le fai nga luenga kongol mental health, especially mental health. Ia ole kam fai le walanga le iloa e palalangi mai si vaenga. Ia ka ko ku male ngu o ke lo la ia o ngaluenga nga o ngaluenga nga ia mo ka ko umale le fainga luenga kongol mental health o kam faila le promote le ka ko culture le la foila e awala ku foila ilunga ole ka fatala noanga le nei aso ia o awala ia e promote ai foinga le peila nga develop e lo fionga le Fonofale model kusala ole o se moro piko siling ka ua foi lea wala ngai le iloa iska ngaka ia le ka kokuma le ngangu e manga ia e lima ka ika i ngai le care le care ko kongo o le health o le ala o ke fifsilia kwa la Fuimaono ona o le Fonofale modo e ele pou o le spirituality ia pol
Ah,
fale anganga ai se ai e ka ua ile malama o kangaka le spirituality e malam inga ia malama ile mental health o kangaka.
ke loa, Ioana, that was really made very pertinent to me. Ke mi leo le tsunami a.
Yeah.
Because o si ma ko workshop ma leoka, ngwhai I whaunga le ma lua ma o I whaunga le I whefo I le me whakisi, whaunga le te rā o ngā me whakisi o I whefo I le mele I le vai, piula.
Yeah.
O le whasili la ma lia ke ngu whamai, le fonofale, ko kele o whai au ngā trend, le mea leo le spirituality. Because we're facing a challenge spiritual from a Christian point of view. Le ko kelo o ngolo falsanga pa ule le le kua I le tsunami po se fasalanga po se punishment po se me fapenga. There was a lot of discussion about that. But yeah, spirituality is not just about Christian. Spirituality is about aingas, about land. It's about you know, like to me, when I looked at the name Fuimaono, because you know, Ono means there's 6 branches. I'm one of those branches. But where it goes back to each of those people, they've left their mark, not only their DNA, but Olako, what I believe is their spirits. And if what came in, and Mesa came in the tsunami. E ke mea le o ke ea kai whangal ko ke lo au nese si ma kua I kua. Ma isi au whainga runga mai ko kua. Te ole e oi au loko whangal e kare sema. But they always, I remember one of them said, se ka kua ve oi ia pianga rung a po. Whak, e rame. Nene whale ba e au aluko ke wa kere kere la
Yeah.
Ka, ai o pili. Wa ke au aka whama e. Sina ke mea na ke whewhea o mua iku mama ko whaki a o kongai ro loko. So I think underneath all that is a certain spirituality. And I think that's why you're for mako ainga. You know, mo spiritual mako ai for you mo aiku ainga. I actually believe in that because they're my own families. So spirituality to me, whether you are efakasa, kakoliko, whatever, that's one part of it. But also, if le spirituality po fo le faalianganga fo le o kanga. It's really more than that. It's also
Yeah.
entrenched in the culture of Samoa.
Sa o le leila u sau noanga. I le da weila o ke malama ila au ia le spirituality. Ia mantua fo la le ka ko kumaleanga ngu. I le mela le o le vafe alo aloai.
Na,
Mo le ava fata me whapea.
na,
E le whaaloalo loa le si le vafe
na,
alo aloai lea. I o le singa kos o le stress o le tangata.
na,
Ia Paul mela ia le tato wanganu o le ieimo me o tua oi o whiangainga.
na,
Mo le tapu, e tua o iei mea e le piso o tai,
na,
ona o le bāwhea loai. I la o la whaawinga ina o le spirituality, po le whaaleanganga lea o te piki ai lau sau noanga le amatanga o tatala noanga e luma mai le Christianity au tua atu
na,
le lean whaawai tato wanganu. Ona a whaapela, that's spirituality to me. Ona ua
yes.
lewa a fia le anganga o le tangata. A le te so tai fo ia inga po fe ese ai. Wo ye wo ye le to nga I ba o tangata ma me
Yeah,
whaapea. Wo le eise fe alo faninga ma se alofa. We
yeah,
fa le la ma le fa alo alo. So it's basically ole spirituality pe se koa le o le kako culture.
na konga. Let me just pick this because I'm a pongo fan mami my former the film Loka and we're doing some work in Polo mental health.
Yeah.
e lunga la le whawhara right, just to give you an example, for ngā le whaonga o le fofole wha Samoa, in
Yeah.
more cases, yeah, mental health, for ngā, I mean, some cases were very hard, like sexual abuse, murder, and things like that. Le whaaleleinga la leo le wha, for ngā le,
Yeah.
how it takes time, but also the concept o le ifonga.
Yeah.
Now, that is when you are hiforosa kangaka Samoa. It's in that. You can't, ya kia lava Ioana, you can't separate that from spirituality.
Mm.
O le ifonga, as it is, no way for making to say, o makonge o se se. We acknowledge le fonga le laham, o makufai ya oema ko ainga. And it's the ainga that's referring to. If you think about it, the first time all of the culture, go back to that question
Yeah.
of the culture.
Mm.
Because if you look at it, there's also safeguard in that. Because fufi oe mole ikonga. By that you're saying is it's up to you now to accept it. Or mai fasioki oe po faise mese ya
Yeah.
oe. But in order to do that, yeah, how I interpret it, you got to go through the sequencing of Samoa or the ikonga
Yeah.
because it can backlash against you. Do you understand? So to
Yeah.
me, when you say about culture yel for four Samoa, that's what I'm talking about.
Yeah. Saulele,
In the
yeah.
culture of Samoa, yel for four. Yel for four, because that's why I love that you're thinking about, the culture is the medicine.
Mm. Yeah, saulele ia ua langa o leala peila o le wata o le spirituality. E
Yes.
once everything o lawa so longa le mea uma o i loa le va fe lo loa i makausi le va fe lo loa. Ia ele fakinga ele si loko lesi.
Ah,
Ma le mafakia lesi o ngā winga o lesi kangaka. Ia koe ngā me whapenga. Ia lawa so longa le. So there's a spirituality in that.
that's right.
Ile o
That's right.
wangala o that's a makwake le ale part o le spirituality, le mental health. Ile to
Yes.
le mu o le mawhauwhau o le tangata.
Well,
So
well,
fifth
well,
is, oh, yeah.
sorry, Yana, just that point. You're going to
Yeah.
make a point there. You see, sometimes how you get to you were well, and then you're developing anxiety, stress. Lama with stress, say for with stress, for with likosia, for the lay, with the on all that. And if you could do that, you become depressed, or you hit it out. Now, the really thing is the spirituality is in all this way of thinking. It's about your role in coffee or mako and everything else. Let me, I can't put it better than this.
Yeah.
One of the heights of, Carla, when I got the honorary from Masi, well, some people might think the Palangi thought, they're out. I was the first and all that kind of stuff. And I was really appreciative. But it needed to be said that although it's an honor, the greatest honor he was dying. Look, remember my whawhkai kui, whawhkai le kousinga wao, ma kousinga rukinga. To me, that is a spiritual thing to me, the lava kofa. And no amount of honor, is it's the greatest honor that anything could get. It bypass all the medals, all the other thing. Because he's saying goodbye to me, but it's also thanking me for looking after him. Now that to me is whether I be a Kalavit. That's the most spiritual thing. My father wasn't a very strong Catholic, nor am I. But to me, that was a moment that really then it was. I can't put a description except it's a feeling of great love and a great honor.
Yeah. Saolele. So ono ta ua umala o mental health nurses,
Yeah.
o le ta wala le o le spirituality i le mental health o kākou ka Samoa ma le Pasifika. O le ala so fina ngalo i le malama o isi tangata mai isi atu nuu i le ta ua le o le spirituality i nai o tatu tangata.
I think for ngale take it away, go back to not just the mental health, but just to go back to the totality of a human being. because it's part and parcel of that human being. The mellow spirituality. It's not just, it's also apart from there might be some spiritual things like values about your relationship with other people, because it's all part of it. But to me, it oh, that's mental health. We don't,
Yeah.
because Ioana, if a mental health person goes and have a heart condition from a oleele or la mental mea will separate mea. But mental health also have a physical illness. Just like a physical person, they also have spiritual health. You know, it's but mental health. To me, the mental health belongs to everybody, just the physical health and everything else. Okay, I didn't think I answered your question, but to me, I can't sort of separate it.
Yeah.
It's always part of that, but it's especially in mental health. Ko ka konga i mental health. See, most of the models that's been developed was developed in mental health. And why is it in mental health, but not the other? Was because we tend to look at things holistically.
Yeah.
Because when I did my general nursing, I did psychiatric nursing first for 3 years, then I did 2 years general in Auckland, my National Women's. It's very much part, you know, obstetrics here, medicine's here, surgery. But and I did, you know, very well in general. And they said, well, how come you're only a psychiatric? No, you're only just mental. And I said, because that's what we were taught. It's about the totality of the person. And that's why, to me, it's a long way around to answer your question. But mental health, particularly spirituality, just as physical health, is also very important in mental health, because a lot of our people are dying from physical health in mental health because they're not being looked after very well.
Sa la sa noanga. O le winga o la u fesili Fuimaono o le ko pekala i le mafatianga o le mafaufau malangona. Lea lai ona a afia tangata i le soifua o le mafaufau. Ia pela o le tatala noinga o le relationship mo malele te winga o le ba fe aloa ai me fapea e leina manu ar fina ngalo le tangata. O lona winga i lau sau noanga ia ma le tatala noanga e te le ala le se fisosoani e te tauna ia tātou la ia. Tātou tātou fisosoani i tātou clinician ia ele ni Samoa ele ni Pasifika. Ina ia o ina la i lātou i le tātou tū ma le anganu. Ina ia lātou i loa la le koa la le awalanga. Our culture is spiritual. And then o le mea lea leinga nga iei le to tu nga I fina nga lo isi ma le mawaise moe le mawaise to o pile mu. Ona o lawa mangua lawa misa maliska haka. Yo lawa le faya. Lawa le faya isi mea. Yeah.
Well, let me give a good example. The condition there to talk la fionga leoka.
Yeah.
Because Samoa, actually fio Samoa or Makai, but she's a forensic psychiatrist.
Yeah.
Ele me whainga whai e leoka se case study. Ele iei a inga.
Yeah.
A maka fo ile a inga ma NGOs. Ele me whai. E whara le kemi, I watched it, whongala a maka sa bokalame. E whai mo mua le whongale the client or the patient. But how they want to do it. O isi whape ia makaras kako loku. O ia whai lako loku. Now, they say, oh, but that's what the client. If it's truly patient-centered care, you go for the patient, not what you think. It's a very good. See, the trouble is, the male clinician, you worked in a psychiatric area or mental health. You mean, oh, but we all respect people for going on up. The way you show it is very different. We show it very different. See, the VAR fell right. And to give you a good example of Luca, now, here's a person who has been locked up for 40-odd days, locked in seclusion. But, you know, all these nurses have been saying, oh, you know, because they treat her as a dangerous Samoan man. But she brought him out. And for that time, when she started off, although he may still have a lot of mental health issue, disorder thinking, he was able to participate because le malama le kamo Samoa, le wha'aloalo. And was able to do it. He asked right questions and everything else. I have to say, Ioana, to me, we've got to be very careful about that because o kangaka yei la oe, but when I was talking last night, or this Kamaka Samoa, she's a clinician for it. She understood it, just like you did. But there are some Samoa who don't understand it because they didn't practice it. So that's why you have to put those things, how do you put that into practice?
Yeah.
See, I think you can. I think you can. You can put a lofa, for the patient. You can see, you feel it. The vibes come out, the way they talk, the way they speak, the way they pace. O le mea a le sika mai, oh, e vavele also one. And then you wonder, but the patients are very good and they lo le ya kanaka le because they understand that worldview that you're coming from. So I believe that there are things that we've got to be careful about because only people who are familiar with it and practice it.
Taole.
Be careful. Be careful. Be careful. Have you practiced it? Oh, no, because we use therapeutic intervention. Because the kilero kan kalai ko may lirope sa makai. O
Yeah.
you may be, but you're nothing. O makai kan kalai po sa fai aule kalmo yay. If only you gotta be careful, it's if going on ki fa nganga. It's na your post kirim fanga so kulunga for me o making there's a very different way, Ioana. For
Yeah.
me, it's about there are things that you can teach Kanaka Leng Samoa. A very basic level, sit down. That's it. Then there's the next level that you, it's just like levels of competence. Then there's the expert, and then you've got the specialist area. Now, I say this to because I know your and also your background, so you understand it. But I will definitely, if I'm talking to somebody who I know doesn't speak Samoa or doesn't understand it, because they want to learn all these things, but they can't because it's a lifelong practice.
Yeah.
It's a practice, Ioana. Well, we got to be careful. Young mai kokong. Ke mele le whaonga soa whanga o kaukua. O kaukua, it's a practice. You do it all
Yeah.
the time. And then
Yeah.
I also vale for my old kaukua, and you know, the other one is Oleale Pule.
Ole ala Pulotu.
Because they're coming from a different space. Ole fa Samoa ke o fa lele va and before that you got to know who the person is. So that to me is very important. But I
Yeah.
also think if ngale so lele so wanga e kawanga o kan hake in power. But the problem with
Yeah.
this is pe o mele kupungi. If ngale they know until they're into trouble. O mai lola I fa pe fa mola Ioana ma ka fa mo tio mai if so so ia ma ko fa I ka ona la si me.
E sa olele.
Carolina, ake pokomo. Ye kaore isi me ke be wala mai ide.
Sa olele ya ele a mga ia mai ka ko sa ilonga mulima.
Ulima. No, but what is sad though, Ioana, is the fact that it's our people who are suffering.
Yeah.
One of the
Sa
key
olele.
things, one of the key problems in mental health right now, in the 20-odd years, I know they still haven't changed the fact that if you're a Pacifica, you're more likely to be committed under the Mental Health or the Criminal Justice Act. You're more likely to be secluded, and you're more likely to be medicated, over-medicated.
Yeah.
It hasn't changed. So what you had to do is the cultural safety. That's another group. Remember, as nurses, we had the cultural safety movement, which is also for because I was also part of that. When with Irihapati Ramsden, it's the safety of the patient from organizations. It's very simply, it's entering a hospital, education, or whatever organization that's been set up by other cultural group without you having to comply to their needs. That means you put your culture, your Samoa aside, and you learn all the palang. And if you think about it, Ioana, as nurses and also as a university, those universities are palangi institutions.
Yeah.
only now you can do what you want to do because you've got we all do that. But it's that finding your way back home. And that's a really big challenge for all of us. It's ele ku mau se me ke fa i lo mo lo fa lo o doctor e ku mau lo la im ku chief o lo ya ya no mo la vale e fa la vale le ngal me fa fa sa le fa angu. That's it's you keep building it.
Yeah. Sa ole le ala so no te lo ole au nga foi le ole develop ole faunga na podcast. O se ava noa e whai loa i le tatoa atunu. Le tā ua o le tū maleanga nu le soifua maloloina e mesel ma fau. Ia o le tā whainga luenga i tutonu o le system. O le wa tātau mo whaila e so. Ia wha malama o tātou tangata. I me sa uni o lai mantua o lai ia interpreters. Ma tangata o le e mawhaina o mai e wha matala le ngase. Ia peila o meleng tātala noa i core values o tātou le spirituality. Tu sala o mea na o le tate mana o i le nei tala noanga. Ina ia whaailoa le tātou atunu. O mea pitusili ana tā wai a fia i soi fo maloloina. A sa ili fofo ili falmai. E te tau na malamalama al vaenga la o mea umai a tau malamalama ina ia amai ele tonga fitinga. E amai o le wa mai umai le healing mo le tangata. E leo le mai o na o fuala au a lele o ele o ato atoa. O la ofisili ala i lau a fionga Fuimaono wa lewa na e ngalua il mental health. O le aso finangalo i le stigma. Le mental health o le pe o le fiatala noa i tangata ono o le stigma le o le mental health.
Ioana. The reason for that stigma o le malama kangaka. O le malama Malaysia me e fongale e kwai. E fongale isa me for se like a scapegoat. E kwai il me i maki ai. O le ngolo malai o ainga. It's that. E va vele kwai. Iwa isa o ngaui o la kwai. Lu malai e la kwai. It's that kind of thing. But you see, the thing is, it's really part and parcel of it's not that. It's stigma is really about not understanding. But kasi nga me why I don't want to separate things. Malisi nga me, if you can stigmatize something, you separate it and then you put it away that I don't do that. It's just that way for and those mental form. It's part and parcel of you.
Yeah.
It's when people say stigmatized, you have to ask yourself, why am I like that? Why am I like, why pe o lau whakukusa li ia Ioana. Iei isi laka i mi. E vāwe, e mesa mo whawhawhingi. E se, e vāwe anga, nga put down na isi whawhawhingi lan. Ie la mo whawhawhingi nga. O la mea ngai whamai, ka ingo ila, le mea ia kua pek whawhawhingi. Ngi hai, e whai anka la whapenga. O la, wa whai uki wha. Kere i wapa la meka whai whonga kala wha. Ia, puki ngi whakpai. O e wha, les whawhawhingi. O me wha, ke whai ngā whai elisa. Whai eso nga mabevesi me kau. Ioana. Sometimes we tend to internalize stigma. We internalize and then we project it to somebody else. So you have to say, I don't. I can't feel me. You personally, what's worse to me. Ole stima ole skanta mo fa I ka ingo yala ni kwa pe ka ni me fa pe la me fa fo o sa mo ba
Ia.
e ke o fa la ko ka fa pe nga I mo o bla le me fa ngo fa ka fa pe nga yeah ile me fa because why if I'm saying that then I'm saying about myself. That's how I work it. Because we know that we all stigmatize that, we all do that, but it's really about personal reflection. You know, Samos kakalo, makongi pope. You know, we Rosalio and
Rosalio.
Reflect. And part of your reflection is, well, you know, you're not that great. don't be so humble. You're not that great. You know, like you, you're great. But there's the humbleness. There's a program, Children of the Migration, and it's now on television. Anyway,
Oh, yeah, I
and
think
they
I
told
saw
me,
it. Yeah, yeah.
but the part where they asked me, what do you think of this one? If you pay all of a city, Saul of a city, for my, what do you think of God? Well, if I think God, because, you know, it always worries me because God is always depicted as a long-haired old man, blonde, blue eyes, sitting on a mountain top. And to me, that's the same. Well, you know, I don't think that's God for me. So what do you think God is? Well, if God is about charity, it's about love and
Mm,
compassion, then I believe God is a woman.
mm.
And he said, "Oh, kingalang eh, fai konga la the fonga la ma kung ngofo le tell well, kafaro wa vava lo fe not choking up because she was very open. Then I said, but if I really had to be honest, I think she'd be a Samoan woman.
Mm.
And then I went on and said, but if I really am honest, I think God is a Fafafinyan.
Yeah, yeah.
You know, Ioana, I really believe that.
Mm,
Because I didn't say that in jest, because God is in everybody.
yeah. Mm,
It's in everybody. It's
mm,
but it's not just people. It's in us, in the air you breathe, because it's in the beauties in the air.
mm.
That's why I believe. But my mother and I had this philosophy: the beauty in the giving is the beauty. If you give beauty out, you can always get beauty back.
Yeah.
So that's a kind of philosophy way to, for me, to the
Mm,
stigma that you took. Because throughout my life, it's not just mental health. I work in stigmatized area,
mm,
but
mm.
my own personal as a Samoan, the racism, as a Farafina about the homophobia.
Yeah, yeah.
So I used to get it, but yet I always say those are the strongest thing about me.
Yeah.
But stigma and discrimination, I'm very familiar with it,
Mm,
and that's why I work in mental health.
yeah. E sa o leila sa noanga i le mela le o le stigma la le o le mental health mai e le fia talanoa i ei tangata. E pe e se mea e wha amu amu tu si lima i e mea wha pea. Ia e toi e alua lala u lo mawhauwhau i definition la le World Health Organization about what is mental health, what is mental illness. Ia tu mai la le definition a le World Health Organization i le mental illness. Le definition a kako o le wai research ma articles, what is mental health ia kako Samoa. Ia o le mental health, ia o le break, o le whaaloalo le wawhea loa i pe your spirit, o le o mai o spirit o nga o le o mai e whaisea o ngā kangaka le wale whaaloalo e mea whapea. So ia awa ia pe e related i mea e negative. I mea le mga uskangaka associate ai. Ia
Yeah.
o le laulol mea ngai le fia kalangoa iai kangaka. But really sa o leila sa unoanga o le malamalama what is mental health? What is mental illness? Ia o le ale causes. Malamalama tangata i le winga. Ia mantua foi Fuimaono e iai isi peila o neurodivergent.
Yes.
E
Yes.
iai tangata e lese lako control.
Ah,
O
kakoma.
la lainga afia i le mental
Yeah.
illness. Pe o le tangata sa ese accidents la
Yeah.
vea lo nao. Ia
Yeah.
po o le tangata na ola mai ma le disorder. Ia
Yeah.
i le ADHD, autism, me whapena. It's something out of their control. Or I think malama leia tangata i a unga malpongai ma mea uma o le mental illness. Ia o laulo o le amwhai foina whaititia ia le mea le
Yeah.
o le stigma i le mental health ma le mental illness.
Yeah, but Joanna, in every case that you mention,
Yeah,
they always recite God.
yeah,
That's when all those, whether you're
yeah,
neurodivergent, where there's
yeah.
God. It's
Mm.
God's children.
Sa o
And
le lei.
so, ole alofa and so even people like that, you see. And I think for Ngalia Calabar, I've seen some very horrific things. I served in the parole board, you know, horrible things that people quiver. But you have to see beyond that and see
Yeah.
God
Mm.
in order to cope with that. And there's always an answer.
Yeah,
I believe that.
yeah. Sa
I,
o
I,
lei.
we have had incidents of, and some people you can change, Ioana. I believe there's very motivated. They just move on. They know all there's not discrimination. There's others who are a bit reluctant. And then
Yeah.
there's other people, no matter what you do, they're not going to change their
Yeah.
mind. You don't bother with them.
Absolutely.
You don't
Yeah.
bother because it's just a waste of your time. Okay, you have to concentrate. It's the one that's very motivated, the ones who are a bit scared that they just need your assistance up there. Look, this is what you do that's discriminatory. It's okay. It's just that you don't understand. You're not being
Mm,
on the side.
mm,
It's so, but to me, it's really the whole thing about mental health is about really bringing it into the open because as part, I think people's negativities of themselves. This is how I see it. To have their view negativity is partly because they're negative themselves, and so they put those part of them as
mm,
a negative part, when really it's part and parcel of your life.
yeah.
Everybody will go up and down. Everybody will do that. You know, and we have to address that, Ioana, because of will not involve le suicide.
Yeah.
O
Mm,
kelo ka le seeking things in Mesia, mo mei o whala au pasa, you know, all
mm,
those kind of stuff. We have to address those kind of things because if I value also come on, it's oh, you're bad. You
mm,
can't because they're God's children. I mean,
yeah.
it sounds. I don't want to sound preachy because I'm not a preacher. But just that sometimes that's what really drives it because I've always worked in mental health. I prefer it. Although I did very well in general, I didn't. I worked in because of you just see people and the sadness. I may say for when Samoan patients were brought in Lungamova'a,
Yeah.
cargo boats, and they changed their names, and I saw them. And their next of kin was the boat that they came on with. It was a type of Tofua,
Tofu.
or Taveuni.
Mm,
I think so. Those are the history. So, and to me, Ioana, mo ka nga kay las ngai patients, but also ngai ka my time. There were nurses, but they weren't psychiatric nurses, but
mm,
there were enrolled nurses, there were nurse aides, but also ngai ka kay more cooks and domestic staff. They were Pacific, and they
mm,
were the ones that really helped you along. So who I am and things. It's all that work and just these are people who just work there and they believed that there was if
mm,
from their own cultural part. So I saw that in action, the Miriam Lufa and what compassion can do.
yeah.
You know, so
Mm.
it,
Sao le le sele tā ua o le alofa, o le caring, compassion, empathy. I nei mea umai vi tuti tonu o le ngaluenga le a tātou tausoifua o le mental health. I le e sa o le tausia ia i se au ngā o le tāpou kalame
okay.
i le whaatāwaina la le o le tātou talanoa i le mental health ma le mental illness ina ia mawhai ei ona address pe mwhai ei fo i on whaititia le tusi lima ia po le stigma ia wa sa o le alau sau noanga o a le lava le malama i se mea ia ele mawhai fo i ona mawai le silafia ma le iloa e whai ei le whai unga le tangata i le anga i lumanai. O te whiapsile tuala Fuimaono. What are you most proud of when you reflected ilo legacy as a pioneer?
People like you,
Oh,
people
thank
like,
you.
but no, honestly, like I've had a real privileged. This is how I explain it, Joanna. When I was a charge nurse at the psychiatric unit in Oakley, Carrington, my number one priorities was patients and their families. And then I left and went teaching in the 1883. My priority became students. The
Mhm,
students were my priority, and really the challenge was to get Pacific students as professors, and that
mm,
I'm very proud of. Then, of
mm,
course, you had the NEVA program, but it was really the highest for me. The achievement is the differences that my work has done to people's lives. And it's not just in mental health, but also in sexual health.
Mm-mm.
I'm absolutely deeply touched when people say, "Oh," people said, "Oh, like you don't remember me, but you did this," and because I don't. To me, that's what's the legacy is the changes in
Mm-hmm.
people's lives, and that is the best. It's but you see some exciting, but people have made changes, and you're going to be changed, but the other side to this, Ioana, I'm also recognizing for only the difficulty for people like yourself. I turned 76 this year, and I'm going to, easily die. I'm not going to be here very long, and that's one of the reasons why I was here. But it's really the hardship that you also have in the future, but also to know that you're following other people, and you're leaving a legacy for other people to follow. I'm
Mm-hmm.
only following a pathway, and part of that is the pathway and you're always finding your way home,
Mm-hmm.
because your home sometimes changes all the time. It's like physically, like I grew up in Taufusi, and then Taufusi to Central Auckland, to West Auckland, Auckland, Palmerston North, Palmerston to Wellington here. So the pathway to the physical home is there, but also the spiritual home.
Mm-hmm.
Like, when I go to Samoa, our house is no longer there, but the first place I always go, that Leota and I go to, we go and get our car, my flowers, and then I go to Mangiangi to see my grandparents and my auntie, Ulaika, Oko Ingai Mangiangi. And then I do my other work. So when you talk about spiritual, that's for me, it's a
Mm-hmm.
spirituality because I'm home, and that's the home for
Mm-hmm.
me. So it's saying to you that I really value this time that you and I, because I know that you're going to make huge differences in the future. And I'm just been so joyful that I was part of this journey.
Mm-hmm.
So whakamaroa kula o whionga, Ioana.
Oh, thank you so much. Okay, o te iloa au ia e mo Mautinoa as a Samoan mental health nurse. Ia mal Pacifica Nurses. Wa te le lau sau i le atina e ina o mātou la nei le fatua o mai tonu o le practice. Ke le o shiu se feel.
Alo,
We were trying our best, but thank you for being a mentor for us.
Malola, whawhakai.
Taluaila na e mentioninga ia le group le o whawhawhine Fuimaono. Ai se ae tā wai whawhawhine le tato community Samoa.
Kei loa, Ioana. I was reading some very interesting research studies, and it's really and it was a really good take on this. Now, there's been always interested in the makeup or the gay gene. It was true in the 80s that when was there such a thing why people are born or people are made, and the gene shows. It was a really interesting research from America. Was that when times of great need or like war or anything, that the women, the mothers, tend to produce like a hormone, and the children or the male are more likely to be somebody gay or whawhawhingi, who is a male, but they're usually a lot more gentler, and they're not sort of very. And so nature has a way of saying that what you're needing is somebody who will nurture it, not rather warlike, because this is a time when people, like different kind of people, are required who will nurture family. And I think the biggest role that Whawhawhinga, that what I believe we have, is that role in families. It's in Anglo Kosingo Makua. And for me, as I said to you, yeah, my own personal thing, Ole Kosinga, and when people said to me, one of your questions is, "Lamina ya way for nursing." Well, I was familiar with Kosio Kanaka, Kosio Mako, your so I'm familiar. Caring to me, or Kosinga is very caring for me. I'm familiar with it, and just like every other Samoan. But ole winga o lokala. So to go
Yeah.
back to the whawhawhingi, because you find that the role of whawhawhingi, I believe, is in the caring. Now, there's nothing wrong with that, because it's families. Well, some people say, "Oh, that's like a domestic." Oh, how no, but to me, that's our power. That's o le tausinga. I really like the work of Sister Shawolia or Sister Vitolia Moa. You know, she does about tosi. You know, tosi is tosi ainga, tosi fua, tosi fanua, tosi, all that. It's a concept of tosi. And I really believe that, you know, for some of us, like Farafinians, have a natural inclination towards that sense of gentleness and power and really caring, but really in particular relationship with their families and particularly their mothers and sisters. So that's one. I think also for our thing, it's time, the context and the time environment has changed. Like there's a lot of, we know that in New Zealand, for instance, that we have had, you know, politicians, we have doctors, we have nurses. I think this we're prominent amongst nursing Samoa. Mrs. Samoa, I think it's quite a natural because they tend to look after families. Very important faction of Samoan society. Yeah. Those of us also, then of course our families, because of our role as socials, then of course then some of us hold titles. Like I belong and all of us, bar one, is we all have titles. You know, Leao, all those kind of names. It's because that's what our family, because our roles has come through our families. And Kosingo or family to me, and especially the Kosingo Makuma Kosingo Ainga, it's the highest form of recognition for a Samoan.
Oh. Ia wai e ka ke whaalongoa fo inga le e iei fo i pei fo i o le mental health e iei ale kusikusi lima le o isi kangaka i le pei wha ese ia whawhapine mai le kako community i le ka whaalongo le iei. So o le asa o whautuanga mo le community whawhapine i le addressinga la ia o tuenga negative ia
Okay, let me.
comments ia.
Sorry, Jan. This came about during the time in the 80s. I really got to know some of the churches. They quote the Bible, the Old Testament. And yet we know through history, in history, you'll find there's whakawhinia engaged throughout history. We know that in the Greece. We know that in Jesus' time there was. We know that because it's a note that one of the disciples would. We understand that. What I always say to Whaafinga is this: before the missionaries came, around about 1830s, when the missionaries came to Samoa, Whaafinga existed. And why do we know Whaafinga existed? Because there's early recordings of Mahu, which is Whaafinga from Tahiti, Hawaii. Every island had their own. O le Aukonga o le Whakawhawhine, or Whakaleiti, which is Whakalady now, o le au Cook Islands, o le Akawa'ine, o le Whakawhawhine Niue, o le Mahu o Tahiti. These people actually existed before the missionaries arrived. So what I always say, before the Christians came, the Samoans had the Whakawhawhine. And indeed, we had this discussion with Pulotu-Endemann Sese, and he said that even Mukalaanga o Moji Ainga, Mama o Ka, but in Ararua you find the Yemulak Whakawhawhine on big titles. But because of the colonization now with the Christian thing, so you have a value, Christian values is Parangi, it's more Israelites, and versus Samoan. And that's where the conflict is. Because under the Samoan, Whakawhawhine is part of that ainga. O le ronga mo whaafinga o kausinga mo ainga, malako if wanga lengla, kona ka whai kausinga ainga, well, you can't. If wanga le oisi, they get married, they leave the family, o le kausinga makua maiskan. But so that point is always there. But we always had that in Samoa. Because early recordings of from particularly from Palangi writings, there's allusion to the Whaafinga, which is wrong because some of the church ministers are saying, "Oh, it didn't exist until the." That's rubbish. We know that Whaafinga existed. It's way back because the earliest sign is was from a ship log in 1768 that recorded a mahu. That they thought it was a woman, but it was a mahu. So it was before the time. So historically, That's what I would say to Whawhingas. No, we have a place in Samoa. How that place is to be determined is between you and your family, because some Whawhine are not, rather than caring for their family, they care for them in a different way, like having, a lot of them are very, very senior in Samoa, in government, in law, in medicine, in nursing, and things like that. And they can contribute to the family. But historically, I just wanted to say that Whawhine existed. And why we know we existed, because there was a name called Whawhine. That was a Samoan term. Homosexual is a medical term, but Whawhine is a Samoan term. So we know that because the other cultures also have a character like that. Or the Akawai no Cook Island, or the Mahu, they record it. So
Ta
that
ua tele lo whinanga lo a Fuimaono. I le e fōlinga mai o le history, e te le history o whawhapine tono le tato atunu. Ia e peila e to e mai ala i le ngaluenga ta ua tono le mental health. E tele nei tamaiti, ma tangata e whapapine. E a whiaola to mawhauwhau e pe stress, e depressed me whapena. Ona o le acceptina i te tono o lato a inga. Po le malamalama po i ma le eise openness fo ina le talia i latou o latou o whawhawhine me whapea. Kusa la o vai le stress ma le anxiety. Le la laina o mai i le tono mental health. A le te whaalongo tu i lau saunoanga. E te le talaanga ma le aonga o whawhawhine. They are a big part of our culture. Tato community.
Well, part of the culture, because ele isla ko upul whaparangi, they had a word called invert. Invert, and then homosexual came under it was around by 1940, 50 that the word homosexual came in. That was the name. But Whawhine existed in Samoa well before 1830s.
Okay.
They were before Mahu. So there was a history. But like colonization came in and they wiped it off. And it's not just the Whawhine was affected, also the role of women. Because we know, for instance, that the first Fuimaono, because Fuimaono comes directly from Kama Kamiki or Kama Salamasingo e Tapumara ia. Ma mai ko inga mai whalealili ki te pakula le Kama Whaungana Salamasinga. And we all know that Salamasinga was the first tupu Samoa. But a lot of people don't want to know that. They say that Salamansino or the sister or Maliakoa, because that's what the colonizers, they wiped all the women out. And the role of women, because we know that women in Samoan society held major titles. But after the colonizers came, the women were reduced and the men were up.
Yeah. So e te lea ala leo ngā ole ta patatala noanga po i le whafonga mai ale tatua tunu. We brought up mental health, mental illness, and then link it with a different aspect o le kako culture ma mea whapea. E sao leila sao noanga.
Well, or milk popolei on el mele or Whawhine and some of the gay things because of the suicide. It's highest amongst gays and rainbow. Pero melan kupus Whawhine lenga was awful lenga front page of the Observer. Luckily, the Samoan Whawhine Association, le susunga Alex Ua, who's a lawyer, they objected and they removed it because it was disgusting. You wouldn't have your family hanging picture of Whawhine. But the point is that a lot of the churches, fundamentalist Christians, especially the new churches here, they come in with a very palangi. That's not Samoan, Ioana. I have a very strong view on that. Because during the homosexual law reform, we had that kind of Western, very much right-wing type. It's not like the traditional Catholic. It's very different. This has got the new charismatic church. It's very, very right wing. And that's also happened in Tonga and Fiji and Samoa. So, but it's against our culture. No. Samoa, we had Whawhingas well before the 1830s when the missionaries came.
Okay.
And they existed not just in Samoa, there was also throughout the Pacific.
Yeah.
But now that's why people like yourself, Ioana, it's very good, like academics. See, we've got nothing academics. And now they're doing the writing. And so they've taken, I love this, or the fauling. See, they're fauling, because now they've got in doing their masters. So saying, well, hold on a minute, here it is here. Because I've read some of their brilliant studies. So all of it is to make sure that it's not about promoting sort of, no, it's not. It's just say, we are Samoans.
Yeah.
We're not the same. Not all the Samoans are the same. We are different. But that's like a beautiful bouquet. That makes Samoan beautiful. It's all different from place.
Sa'olele.
Almela unless you're blue or red or green or that's Almela, it's every beautiful color.
Yeah. Kasi almen kako mai umai. Kasi la kungu. Kasi kako whawai. Sa'olele lau sau noang.
Samoan's very inclusive. And you hear people say, in those years ago, you know, you never hear Fafi being kicked out like you hear mothers say, it's like a sin. That's where it's really different. So those are kind of messages I would like to give to Fafi, where for their mental health, but for all Samoans. It's not just the area of Fafi, but also we have young people who have trouble with sexuality because this thing about, you know, unplanned pregnancies. See, I worked in that area. A lot of the kids that were unplanned pregnancies, it's because they lack knowledge. They didn't have the access and information. See, and then they're being turned on when they, you know, kids, people experiment. But knowledge is power.
Yeah.
We know that. But for some reason, there's a real thinking coming out, Zamo, that you exclude the knowledge, those people. To me, that is absolutely wrong. The people have to have information to make decisions, whether you're in Samoa or in New Zealand.
Ia nga. Sa'olele ia. Malo sau noa.
Malo.
Oia, e fōlinga mai le tātala noanga i tele i au tiute. Tele fo ilo sila fia malo wiloa malo experience. I au te fia iloa la Fuimaono. How are you looking after your mental health?
Gaylor, o sea, you know, we've been together about 43 years. Faso koko sanga ngofo. And uma ia so for ngai uma ko ia lo me ngofo i crisis. O kini fi ke ngengu. But for me, how do I look after my mental? I love reading. Gaylor is a lot fi pa o and I love reading things mo kala ango ko skang sa mo fo ngale. So I love reading. I write sometimes. I'm a lazy writer, Ioana. I want to write all sorts of things. I always say that I want to write gay-ish romances because that seems to be the notch. But I like to write fiction, and I was saddened that yesterday that one of my favorite writer passed away. Writing, I love the new writers coming through, like playwrights. Most of them are Samoans. They're really dogmatic. Karl, you know, all those kind of. But I love writing. I love reading. I love going to the movies and I love the theater. After our meeting today, I'm going to go and have a practice. Then I'm going to brighten up my hair and my look, and because I've got to do workshop next week. Yeah, and also the other thing I'm trying to cut back. My favorite Samoan food is kalumale masimba. But I know it's the wrong thing to, and I know. Don't tell me about the theory. But I also enjoy, I've got to be honest, I enjoyed this, like this. Just talking to people like you, Ioana, just gets my thinking going. So, whamano, whakaila mangeava ngoa, la susunga for my Dr. Ioana Mulipola.
O ngai o lo le ale ia iau o ia wala e look after ilo mental health. O le ala le, what are your plans in the future o le Fonofale model?
I think Fonofale model is going to have a lot more audience. I think the Fonofale is out there for people to use. To me, it was out there for the lots and lots of people using it, and that's what excites me. I hope everybody has, but I hope there's more people can use it for themselves, or they'll adjust it accordingly. But yeah. That's my dream. It's out there to be used.
Ia Malaysia mea ia not only nga ole mention i health reports ma mea whapenga i kokongo le health.
Well,
Wala i loka ika experience. Nga ole mention, Fonofale model mention, it's mentioned everywhere. I
yes.
kongo reports, kongo strategic plans and all of that. Ia ole manga ia e incorporate into the practical application o le care. Pe o mea ang kakalangoa i ngei, mea
It's
umai ang
practice.
kakalangoa. Ia, in practice,
In
ia.
practice, it is because since then, because setup the Fonofale was in 1985, and then the setup of the cultural clinical competence. Remember, I was involved in the
Ia,
cultural
ia, ia.
therapy movement on nurses, and that was in 2006.
Mm.
So it's a combination of those three. When you're asking the question, like I think Fonofale it's much better as an assessment model. The
Okay.
Kalisi is very good for operationalizing the Fonofale model. And the Seitapu really is really looking at the cultural competence, clinical of the person using the models.
Mm,
Having some understanding. But you had to understand the ngangana, the language.
mm,
You
mm,
got to understand the ethics of any organization you're working from. You also got to understand. So it's really about when you're working with more families. If you were working with, say, a Samoan family, according to the say tapu, and I love using. I'm a colorful person, so I
ia,
like
ia.
colorful for say why we just say lo wow. It's in a sacred place. That to
Mm,
me
mm.
is so. If my message, don't be boring. That's what my friend Lisa Corley, when she was alive, she said, Karl, don't ever blend. If you're going to blend, be like a curtain, and don't be boring. Be colorful. She was the one that calls me colorful. So be colorful in your work. And that means that, you might be pushed back from, right, but it stands. It stands. So for me, all the things that you mentioned, which I'm very grateful, but it's not me, it's the people who made it work.
Mm,
I just put it out there, and I'm just grateful to those people and they've taken it to the next level. Like
mm,
those people, it's developing in nursing education, but it's taken it to other areas. And
mm,
I suppose, Ioana, it'd be like yours. Your work is going to be that, but I'm really excited because you're one of the very few Samoan who's working solely in mental health.
mm,
A lot of them work in general as stuff, but mental health, but also at your level. I can't think of a Samoan at your level.
mm,
Not a Samoan mental health nurse.
mm. So, mana ia o le whaawau pe o le ngaluenga,
Sure.
le na mata mai e lau fionga le ngaluenga le advocating na mo tatou tangata e tutono o le mental health. I nei a kungu o ngiusila, ia, le lai whaapopo i ma Dr. Leota Lisi Petaia,
Okay.
because she's the only psychiatrist, Samoan psychiatrist mo tatou. Talusia ia toʻatele le auwa ua o le
Waka.
toʻatele au o kakou foi lea e alagaʻiga le support mo gai o kakou kagaka i kokogo le soifua malōlōina ia o le tele foi lea o le silafia onai o tatou tagata i lenei mataupu o le soifua o le mafaufau ma le gasegase o le mafaufau
Well,
ia o laʻu fesili mulimuli a Fuimaono. Kalu ai o le pioneer o le ana e muamua agalua i tonu o lenei atunuu ua tele foʻi ia matatia ua e ausia i lou soifua tautua o se tausisoifua Samoa. O le a saufautuaga mo tausisoifua laiti a Samoa le fatoa o mai tonu i le nursing i le agaʻi le lumanaʻi.
Ke loa, your whawhkai lava, I've been thinking about that because some of the kokelo of necessary we teach. A whape we kuhu, we whape o Samoa, o le nurse. The first thing you do is then you gotta front up. I want to le lo Samoa when it suits. Because I know there are a lot of people out there, and let's be honest, you do as well.
Mm.
Because being a Samoan has a yung roots. It's about the service. That's when you really have to really front up. You could be a New Zealand born, or you could be a very Samoan, a very newborn, or you could be from Samoa. Everybody has to have that. Really, what does that mean to be a Samoan mental health nurse, and where does that going to take you? But also for you personally, because I hear people say, "Oh, I'm very passionate about," I have to tell you, he's going, "Oh, we all get on the boat and we'll get," well, sometimes I don't want them on the boat because it'll sink the boat. Get them off. Fucking no, but what I'm saying is that it's a real personal journey and you can't impose. I know what it took me. There were some very, very joyous times, but there was also some very, very hard times. And I choose not to go there because it just would not do any harm. At the end of the day, Ioana, it's about your own integrity. I mea ume ka kau ia oe lava whapea. What are your whongale whaangangu whongale you believe in? O le alofa. The other one that's very strong is o whaamaungu. Ke loko, ke lo kaka mele sa o pepelo. Pepelo to me is it's not based on alofa. O pepelo. Don't call it that, anything else. So it's really about whaamaungu, whaaloalo, mo le alofa, but also lo kosi ainga. And that has a very different meaning of the thing. But it's also he mea le loko alofa. You know, one of the, people will say, but loko alofa, and but you then having said that, then that's all you have to put it in practice. So people say, la model of practice. Faku lea, whaaloalo, le alofa, kausi ainga, kausi le kua, whalangungu. There's that whaamaung. Those are my practices. Those are my model of practice.
Malo, tele se o ngā mō mātou ia, me selva ngā laiti fia follow for your footsteps. Maua e fo le achievement wa mau e lau fionga e mita e fo le anganga i le o se role model fo le mo tātou Samoa ia mai se lava ia le matanga luenga tātou matanga luenga o mental health e sa ola sa noanga tau le ai ni si o tātou i le matanga luenga ia ala uloa ia tasi lua tangata ia walava lea e tau avea ia ala uloa wa avea le nei por kalame me o le la tili aina to tele tato kulupu e o mai e pia i le ngata o le clinician o mental health nurse o doctor or whatever ia te lela to iloa ia o le situ ia wa iloa e wasila fia i fo ele tato atunu ia le alea me o le mental health o le alea me o le mental illness ia tau fai tutusa o mai pe ona e sau noa e tau tato wo fatasi le clinical mal coach tau tato wo fatasi e o te loa ia au sia ai se community fia ia manuia ia malesi lea ia iloa lava ele tangata ia vai le lelo na ia soifua malōlōina o le mafaufau le ngata ia e whapea ia lona ia ainga. Ia, pe ese si mata upu te fia sau noa ia wha uma meta por kalame Fuimaono.
Ioana, I just want to say to you, let's say there's very few of us, but if you get paid for we've got all mental health units. We have mental health models, yourself. There are mental health nurses, but there's only few of us. Sometimes you don't need that. Sometimes what you have is the right people. And the right people that's what's your own personal integrity, but also the vision. Well, okay, when I think of all the money that is gone to things like diabetes, chronic diseases, Pacific Diabetes Unit, Pacific, so we're going to also congratulate people like yourselves that just really pushing it to that level. We have to, Ioana, because sometimes we forget the thing we've come from. But my last point is this, that sometimes the problem may not be you, it's the fact that what you're promoting is ahead of its time. And my point is this, look, Ioana. It was only some years ago that Ministry of Health, the World Health Organization, came out with this so-called thing like there's no health without mental health. Ioana, Samoans knew that from a long time. We had the Fonofale who said that. We had it. That's the point I'm making. That sometimes what you're developing now, maybe it's a bit ahead of its time, and the time will come. When I developed it in 1985, I never imagined that now we have all these people doing it. All I did was just to share. I just said for people to use. It's the people who took it to the next level. And so it's a word of encouragement, not only to you, but those people who may get put back from lack of funding, lack of understanding. Sometimes your work, your timing. And what I learned is it's just that sometimes your timing it's a bit ahead of its time. And you'll find people will come back and you laugh when you say, oh, suddenly there's all the... And one of the things that I always mentioned was the fact that when I did my general, we had this plastic surgeon from, I think, Middle Mall, was going how wonderful all this kind of thing. And they were talking about how during the war, this brilliant guy found out that the brilliance of using saline, because the pilots who were shot down and landed in salt water, they healed because of the salt. And that was the finding. And I said, Samoans have used saline for hundreds and hundreds of years. Without exception. I remember, we used to lie, it's in my idea, when you watch the kids online, like, o ka meki whanga whaika, o ko mawhiki the Samoans had it. So I'm saying is sometimes, what we told as those ancient things for Samoa, the Samoans knew that from a long time. And so that's why I don't ever get put back. Just the fact that, that maybe the work you're doing now is foundation for the future.
O le atu le whaaftaitele lau fionga Fuimaono, mo le whaavanoina o lau taimea tā. Pitu sili ona tā ua tā te whaasoa ai, ia maa matai fo ile season 3 o le whaungangana podcast. O lau fionga, o le te le lau sila fia ile area le a tātou o le mental health. Ia o se mea alofa fo ile mo le tatou atunu ua o te iloa ele o iloa tele le tatou atunu le Fonofale modo. Ia manei mea uma ia ao mea sili o le ua whaafonga silasila tatou atunu i le tele o lau tautua. Mo le tatou atunu e ala i lau ngaluenga. Ia ai wha malo whaafitai.
Whawhetai tele mo lau mai mo mai. Tali tonu wa iese au ngā o mta upu sa tala noaina mo oe male ainga. A whai au ngā nei whamatalanga. Like, share, ma subscribe mai i le tātou porkalame. Tātou toi whailoa ai i le porkalame o so mai. Soifua mai a manuia.